An amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. We had already done a video about patient complications. It is available in the playlist. You can check it. Now we are going to see about technical complications of hemodialysis. The technical complications are clotting, blood leak, power failure, hemolysis, hair embolism, exsanguination, dialyzer reaction, clotting in the extracorporeal circuit, formation of blood clots in the dialyzer and bloodlines, causes inadequate anticoagulation, low blood flow rate, air in bloodlines. Clotting. Signs of clotting are increasing venous pressure readings, dark blood in lines or drip chambers, fibrin in drip chambers, visible clots or clumping of dark blood in the drip chamber or dialyzer, TMP alarm problems. And the treatment are anticoagulation, vascular access, that is needle placement, CVC problems. Blood leak. The causes are membrane rupture allowing RBCs to cross over the membrane into dialysate, and the signs are blood leak alarm, positive test for blood in dialysate, and the interventions are check dialysate outflow with blood leak strip. If positive, stop treatment, do not return blood. If negative, may need to get different mission. Causes. Electricity is disturbed due to the emission. The signs are unable to mute alarms, air detector trips, clamping venous line. And the interventions are know how to free venous line and hand crank blood, company policy. Hemolysis. Breakdown or destructions of RBCs. Releases potassium from damaged cell into the bloodstream, decreasing the oxygen carrying capacity of RBC and potentially life-threatening. And the causes of hemolysis are mechanically poor functional or incorrectly calibrated blood pump, excessive negative pressure in the extracorporeal circuit, over occlusions of blood pump. The chemical and thermal causes are delivery of improperly prepared dialysate, dialysate contaminated with chemical agents such as formaldehyde, bleach, chlorine, copper, nitrate and nitrite. The thermal are overheated dialysate. Signs of hemolysis, dialyzer or bloodlines. Patients shortness of breath, chest, abdominal or back pain, cardiac arrest. Air embolism. Introduction of enough air into extracorporeal system to stop circulation. And the causes for air embolism are empty IV bag, air leak in bloodlines, air detector not armed, loose connections, separation of bloodlines, patient inhales while central vascular catheters open to air, pre-safety checks not done or done improperly. Signs and symptoms of air embolism. Extracorporeal system, air pocket or foam in venous line, patients coughing, shortness of breath, chest pain, tachycardia, cyanosis, confusion, possible cardiac or respiratory arrest. Treatment for air embolism are clamp bloodline and stop blood pump, place patient in Trendelenburg position, turning them on their left side. Treat symptoms like oxygen to address shortness of breath and chest pain, normal saline to support blood pressure. Air in bloodlines. The causes are underfilling drip chambers, empty saline bag, loose connections, dialysis needle removed while blood pump is running, poor priming. Air in bloodlines. And the signs are air bubbles form in bloodlines or air in blood alarm. Interventions. The preventions are keep level of drip chambers up, replace empty saline bags immediately, tighten connections when priming, take needles securely, follow correct priming procedure. Exsanguination. Extreme blood loss causes bloodline separation, needles dislodging from axis, rupture of axis, crack in dialyzer, loose dialyzer. Symptoms: blood on the floor or in the chair, hypotension, mission pressure change alarm, shock, seizures, cardiac arrest. And the treatment of exsanguination are identify the source of blood loss, stop dialysis, return blood if possible, treat the symptoms, give normal saline to support blood pressure, oxygen for shortness of breath. Dialyzer reaction causes first use syndrome, hypersensitivity to membrane. Dialyzer reaction first use syndrome is back pain, chest pain, hypotension, pruritus, nausea, hypersensitivity, anxiety, pruritus, dyspnea, chest tightness, possible cardiac arrest. The dialyzer reactions preventions are use of synthetic membrane, reuse of dialyzer, proper priming of reuse and new dialyzers. And the interventions are stop treatment if anaphylactic response, symptoms management. Thank you.